Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. Welcome to this week's edition of Medically Speaking. Our guest this week is Corey Beverly Waters, a neuromuscular skeletal medicine and osteopathic manipulative medicine specialist at Southern Maine Healthcare. Dr. Waters, thank you for joining us on the show.
Thank you so much for having me, Robert.
So we always like to start the show to find out a little bit about you and how you came to study medicine and practice it here in Maine. Maybe give us a little background about how you ended up here in Maine.
So it's quite a long story. I'll give you the brief version. I actually did a program in high school that investigated different careers. Initially, I thought I was interested in physical therapy, but after doing some further investigation, I found out about osteopathic medicine. And I was really excited about combining the hands-on element of physical therapy and also kind of the mechanical aspect of looking at the body and the structure of the body and the diagnostic ability of a physician. So from that program, I did an undergraduate in St. John Fisher College in Rochester, New York. Then I went on to medical school at Ohio University in Southern Ohio. From there, I did a family medicine residency in Akron. And from there, I did a fellowship in Bangor, and then I looked around for positions and found myself at Southern Maine.
And how did you make the decision to settle here in Maine?
So there's lots of great things that this particular area in Maine has to offer, one of which is blueberry jam. Wild blueberries, LL Bean. No, actually, I like being so close to the beach. I like being close to mountains. We were just out last night eating in Portland, fantastic restaurants. Traffic here is not so bad. I mean, there's lots of good quality of life options around here. And the people are great.
So for the good part of the last century, people have been talking about the difference between osteopathy and allopathic medicine, basically the DO versus the MD. Maybe you could give our listeners a description of what the difference is.
So, unfortunately, many people in Maine are much more familiar with osteopathic medicine because there is a medical school here at UNE, and it's actually the only medical school in Maine. However, I still find myself explaining quite often because DOs are still the minority in the physician population compared to our allopathic counterparts. We only make out about 10% of the physician workforce currently. And the whole osteopathic profession actually was born out of a allopathic physician in the late 1800s that was looking for an alternative to the current heroic practices. And when I say heroic, what that really means is bloodletting and using leeches. So medicine at that time was quite different. And he was thinking that there has to be a better way to treat people and to look at it as a whole, so he turned towards anatomy. So really osteopathy at its bare bones is really based on the influence of structure and how that can affect the function of the body. So really looking at kind of the outside in and how that can impact things. Now, the basic difference is both of us go to medical school. The osteopaths just go to osteopathic medical school. Allopaths go to allopathic medical school. But during our schooling process, we actually take additional courses to learn more about the structure and function and how we can use osteopathic medicine to influence that and manipulation as a technique to make a difference. We both go to residency. We both can specialize. An osteopath can be your local surgeon or your family doctor, or like myself, can specialize in the hands-on principles of osteopathic medicine, known as osteopathic manipulation.
So you can walk into any hospital and there'll be a diverse selection of osteopathic versus allopathic doctors, correct?
Yes.
Are there any hospitals that specifically would offer only osteopathic doctors?
No longer. The last osteopathic-only hospital, I think, was absorbed in the early 2000s. So with the change in our healthcare system, it made more sense to make bigger conglomerations of hospitals in order to receive insurance payments. So those have all gone by the wayside.
So do you find that patients will sometimes come to you and they'll see the letters DO after your name and that causes some confusion?
A lot of times patients aren't even sure if their primary care is a DO or not. They just know, they just go to their doctor. And my doctor told me to come here, so it must be good for me. So I kind of give them a general idea of what that appointment will be like and what to expect. And a lot of times I'm asked about the difference between what my hands-on treatment will be between that and a chiropractor. And I start with the basics of both of them are hands-on treatments, but you have the benefit that I'm a physician, so I'm going to do a full diagnostic and evaluation. If I feel like your treatment needs further imaging or injections or other options or alternatives, including medications, I can prescribe. I can write for your MRI. I can refer you to another specialist, and that's outside of the hands-on option. That is one of the different things between myself and a chiropractor. The treatment itself can also be vastly different. We look at a lot of techniques that I do are myofascial techniques. What that means is fascia covers our entire body. It's this really thin sheet of material that, as we are learning more and more about, can get tension throughout different areas in the body. And just like a tight muscle can cause dysfunction or can cause problems. So I look at basically the body as a whole, including the muscles, the myofascial system, included within that, the skeletal system, even including lymphatic and nervous system. So it's really a comprehensive evaluation, not just looking at the spine, where a chiropractor would be coming more just from a spinal adjustment perspective.
So what sort of things do you treat?
So I treat a wide variety of conditions. I personally see everything from newborns to elderly. So for newborns, I see kids that have what we call plagiocephaly. No, that's the technical term, but really what that means is a misshapen head. So if you notice that your son or daughter, even your grandchild, has a preference of laying on one side or the other, or develops a flat spot, that's what that basically means, is that something is misshapen in their head, which is very common, especially with our Back to Sleep program now to prevent sudden infant death. We're seeing more and more of this. So plagiocephaly is one of the most common referrals in the newborn period. Then kind of moving on to, the toddler age, we see a lot of kids for ear infections, recurrent ear infections. We again address the kind of structural aspect of the body to help the ear drain better, which actually has some great research behind reducing the number of antibiotics used as well as reducing the number of tubes that are required. Moving on from the kind of our younger age kids, we see adolescents, any sports-related injuries, ankle sprains, knee injuries, low back pain, shoulder injuries, tension, headaches, migraines. Really see people for the gamut. Also treat pregnant ladies with kind of the general pregnancy-related aches and pains, which how can that not be expected with all of the things that are happening within the body? And then again, the elderly kind of changes related to arthritis, and kind of all of the things that end up coming with that.
Now, how do you approach, let's say someone comes in with a standard complaint about something, does your approach differ, let's say, than if you were an MD?
So my standard evaluation upfront will probably be pretty similar. I'll kind of ask you the generic questions, see how you came to this injury, and I'll even kind of investigate into, what was happening in your life when this occurred. Was there a different stressor? Were you sleeping differently? Try to identify really what the etiology was in your life. Then outside of that, I'll look through all your comprehensive medical history to see if maybe a surgery that you had when you were 25 is impacting how you're functioning now. A lot of people come to me, for example, with upper back pain, and then they've had heart surgery. And for heart surgery, when they have to open up through the chest, you can really get a variety of tensions, and that can really translate through the chest cage itself. So trying to look at all of the different elements in their history of how that can impact their structure is really where things start. Then from an examination perspective, I really do a head-to-toe exam, including some of the routine elements that you would get in an allopathic exam, muscle strength, reflexes. But then I really use kind of what we call tissue texture, how things feel, to see where there are strains in the body, where there's tension, and look to those areas to find out where what we call the area of greatest restriction, or the area where things seem to be organizing around and causing the greatest issue. For example, in tension headaches, it may not always be in the neck that the issue may be. It's very commonly either in the upper back, or sometimes it can even pull down as far into the pelvis. If it's occurring like after a car accident and the pelvis is restrained and seat belted and you're moving around a fixed object, there can be tension all the way down into the pelvis that can cause tension headaches.
So what's the first thing that you look at when, let's say, someone comes in with a common complaint of lower back pain? What's the first thing that you look at?
Yes, Robert, low back pain is definitely one of the most common complaints that we see, because I think it's probably the most common point of access is generally pain-related issues. Lots of structural things can go on with a patient with low back pain. Most commonly, one of the most common is related to muscle spasm in what's called a hip flexor muscle, known as the iliopsoas. That muscle attaches in the upper low back, crosses all the way through the hip down into the leg. And again, with our, sitting, or even if you are working in a stooped posture or out shoveling, this is the muscle that's going to be spasming and be quite the troublemaker. One of the other more common muscles that can also happen is a muscle called the piriformis, and that's in your buttock region, and that attaches from the base of your spine all the way out to your leg, and that can be a mimicker of sciatic. So if you have pain that's coming from your back or from your low back down into your leg but isn't crossing past your knee, it could be this muscle. So just because you're having pain that's coming from your back down into your leg doesn't mean that it's a sciatic involvement. This particular muscle, in 13% of people, can actually, the sciatic nerve can actually travel through it. So tension in this muscle is going to directly irritate that nerve and cause nerve type pain.
Now, a common question that the listener might have is how do you cure something like an ear infection with OMM? How would you deal with that?
So one of the many miracles of the human body is when we come out through the birth canal, the bones of our skull are mostly membranous. They're not what we call ossified or formed into bone. And within that membrane itself, you can actually have tensions, just like you can have tension in a muscle. So how we look at that structurally is the eustachian tube is what's responsible for draining the ear, and that actually drains into the back of the throat. The eustachian tube and the whole ear complex sits in a bone in the skull that's called the temporal bone. Now, that particular bone can get tension in it, and even the base of the skull and kind of the base of what we'd say where the neck joins the head can have tension. And by releasing the tension between those areas, you help, again, structure influence function. So by improving the structure, we're improving how the middle ear drains.
So one of the reasons that you're here is to talk about osteopathic manipulative medicine, or OMM, which seems to be gaining in popularity these days because people are always looking for alternative treatments. Tell us a little bit more about that, and you also have an interest in pediatrics, and maybe just talk about that a little bit.
So the treatment itself, again, is comprehensive kind of from head to toe, and it does involve kind of looking at all elements of the structure. So if I feel like your lymphatic system, or let's say you're coming in with a cold, is kind of the bigger element of what's causing your pain or congestion, I'll address kind of that system versus looking at more of the musculoskeletal or the muscles or the bones and seeing if that is the bigger issue. The techniques can vary pretty widely. So I always tell patients, if something's uncomfortable, you're not sure about it, just tell me as we go along, but I'll notify you if I'm going to do something a little bit more sudden. There won't be any sudden force or things that you're not expecting. Everything is really working with the patient's body and letting them basically control the treatment. And osteopathy, in one of the many ways it's different, is about having the patient's body heal itself. So it's not about what I'm doing to the patient, but it's about how the patient is participating and trying to reach what we call their health, or their neutral, their ability to kind of regain what is quote unquote normal.
What sort of injuries have you treated over the years where you feel like there was some sort of dramatic recovery that was based on OMM?
So I'm quite fortunate to see a lot of patients that have some pretty dramatic improvements on a daily basis. And that's part of why I do what I do, because I'm able to really impact patients in a way that they are not able to get outside of my practice, because of the way that I evaluate and treat patients. Really looking from that whole body perspective, including into what are they doing in their day-to-day life that's influencing how this pattern is still happening. And I think that's part of what makes this different. But I can give you, multiple examples, but one of the most recent ones I just saw in the office recently was a patient that had been through, and this is a very common scenario, had been through pain management, had a low back pain related injury at work, had a lot of difficulty, didn't really get much improvement from injections or physical therapy. And physical therapy is a fantastic modality, but often if the body structure isn't aligned first, you can't strengthen and help reduce pain. So a lot of times I use physical therapy after we kind of get them into alignment, but they had kind of gone through the physical therapy, through pain management, and we're just in a spot where they weren't really getting much better. And generally I tell patients, 3 or 4 treatments in, depending on how long you've had this issue or how chronic the problem is, that's when you kind of see the most benefit. But we were really, chipping away. There were a lot of what we call layers. So the body is fantastic at building up ways to keep the body moving. But a lot of times when you're trying to remove those layers, it can be kind of a process. And even in that process, you can have some discomfort. But essentially, as we were kind of working through, they had pain down the leg, but the pain down the leg related to some tension in the knee and the foot. As we started to resolve the knee and the foot, that helped correct some of the tension in the pelvis and the low back. Working further into that area, we were able to actually put in a heel lift to kind of correct some of the leg length difference. And then really work our way all the way, literally from head to toe, all the way up into the head, and how the strain into the back of the neck relating to some neck pain was kind of able to be resolved by really looking at the comprehensive picture.
You're tuned into Medically Speaking. Our guest this week is Corey Beverly Waters, an osteopathic manipulative medicine specialist at Southern Maine Healthcare, and we'll be right back with more of our talk right after this.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back with Dr. Corey Beverly Waters, an OMM specialist at Southern Maine Healthcare. Now, do you have to explain to your patients what OMM is? And unlike a chiropractor who may see you ad infinitum, there's a fixed amount of sessions that you're going to be treating your patient. Why don't you talk a little bit about that?
So generally, I try to mention to patients up front how this process works, what to expect. My goal is every time I see a patient is in order to get their body to start healing themselves and feeling better. And in that process, there can be some discomfort the day or two after treatment. They can have different types of pain, or maybe even their first treatment, they may not notice much difference. But kind of the cumulative effect is the difference in what we call, again, the tissue texture, about how the body is responding to the treatments. And we really look at trying to, each time they come in, I do another comprehensive evaluation to see where the tension is within their body and how things have changed from appointment to appointment. If it's not changing, we look at further into what they're doing in their day-to-day life. Are they spending a lot of time in their car? What's their position in their car? Are they spending a lot of time on the computer? What's the position while they're spending time at their computer? And really, what is impacting their ability to make progress? Difference between that and kind of their chiropractic philosophy is generally they see people on a week to 2 week basis and go in for more of a maintenance. My objective is more correction each time I see the patient. Now, that's not to say I don't end up seeing patients, every couple months if they need it, but my kind of tendency is more to go for, let's see how you do right now. If things feel great, give me a call if something starts happening again. I've got appointments built in my schedule to get those patients in that type of acute onset or a new onset injury.
Now, you mentioned earlier that you have an interest in working with children and pediatrics. How is that different? Do children, is there any expectation that they might have or not have that's different than working with adults?
Well, children don't really they don't come in with expectations of how the appointment's going to go. One of the many benefits of children is they haven't spent years texting or being on the computer, so they don't have years and years of built-up tension from that divorce that they had, or that bad relationship. So their tissue texture and their body responds much faster. And so it's nice to be able to influence such a young life so early and so quickly in order to get them on the right track.
Do you see a lot of soft tissue injuries that's related to the way we live these days? You mentioned repetitive motion, people sitting at computers. What kind of issues do you see in that regard, and what advice do you give people?
Yeah, so it's very common to see what we call postural strains from improper ergonomics. Ergonomics basically just meaning how we use our body in our day-to-day. Very commonly computer strain-related injuries where if it's an issue, especially on laptops where you can't adjust either the keyboard or the screen position, that people kind of set their neck forward and kind of try to look closer at the screen if the font is too small. Recommendations I would have for that is either you can adjust the font on the screen so you don't have to get so close to the screen so you're not squinting. Generally, I also recommend that there's options if you do have a laptop that you can plug the laptop into an external device so you can use an external screen and even a keyboard if you need it, just to get you in the best body position, because especially, 90% of us are spending, a substantial amount of time on the computer all day long. So that's really important if you're spending that much time. Our bodies weren't meant to sit statically for that time period. We were hunter-gatherers. We weren't sitting at computers for 8 hours. Maximizing that positioning is one of the most important recommendations I would have.
Now, for the listeners who are listening to this and thinking, that sounds something that I'd like to explore, how do they get in to see you?
Well, thanks for asking that, Robert. Referrals are generally required, but depending on your insurance, you may not need a referral, and that will be sent from your primary care physician. I think currently in our office, it depends on how the referral is sent. If it's sent urgently or not, your office your primary care office or your family doctor's office can communicate with our office if we need to get them seen in sooner. We do have some flexibility in the schedule for those urgent needs. Depending on the case-by-case basis. But on average, we're able to see people in, I'd say, 3 to 4 weeks for their first appointment. And then after that, we're really able to get them in much more efficiently.
Now, people really love to connect with their doctors. What do you want people to know about you as an osteopathic doctor? What would you tell them about you?
Well, I think, Robert, the most important thing for patients to know about me is that I'm with them in the process. I want to see them get better just as much as they want to get better. And that I will do kind of whatever within my power to make that happen.
Now, in OMM, do you use less medicine in terms of prescription drugs, et cetera?
I would say I rarely prescribe medicines, but when necessary, I definitely do utilize them.
Now, from an osteopathic point of view, what do you recommend for people to do to stay healthy? Should they do regular activities, yoga, et cetera, that kind of thing? What do you tell people in terms of staying healthy?
I think kind of the general, eat an apple a day and to do routine exercise. I think one of the biggest issues we just don't move enough. And when we don't give our opportunity for our bodies to move enough, that's where we develop a lot of tensions. But eating as healthy as you can. And that's not to say that you can't go out and have that greasy hamburger that you enjoy, but within reason. I think the food we put in our body makes a big difference about how our tissues are able to respond and how we're able to recover after injuries. So giving our body the best fuel as possible and try to move within reason, even walking. Walking is fantastic, especially for low back pain, people with osteoporosis. There's great research behind it. I'm not saying everybody needs to do a marathon. I'm not doing marathons. But getting out there and doing some routine movement, because that's not necessarily built in our day-to-day any longer.
So you just touched on this subject, but let me ask a more direct question. How does diet affect health in your opinion?
I think it's quite a bit. It's the building blocks we're putting into our body in order to see that our body heals. More and more research coming out about gut health and how the bacteria in our gut can influence how we process foods. And I really think that the more chance you can give yourself from all perspectives to be better, feel better. And food is definitely one of those.
Now, do you hear from patients about gluten, for instance? That's sort of the issue du jour. Do people come in and want to talk about that?
Yeah, gluten's a little hot button right now, isn't it? I get questions about all different types of what's the right exercise? How do I do this correctly? You know, what do you think about this particular diet fad of the time? And gluten is definitely one of those things that is somewhat of a hot button topic, and I think we're still learning more and more about. And but I do think that spectrums of sensitivity do exist. They have shown that there are genetic markers that not everybody, there are basically a range of genetic markers that can be done, lots of testing for true celiac disease, but I do think an element of gluten sensitivity, or at least to high carbohydrate diet, so lots of bread and starches being the carbohydrates, can affect how people feel. And I think generally a diet lower in carbohydrates, including sugar, is a better option.
And what do you do personally to stay healthy?
Well, you try to practice what you preach, right? I'm a pretty big outdoor enthusiast, so snowshoeing, cross-country skiing currently. In the summer, I like to ride my bike to commute to work or ride the Eastern Trail. It's a fantastic option we have around this area. I try to eat, reasonably well. That's not to say that I don't enjoy a good piece of pie, but you gotta keep the balance.
Now, if someone comes in to see you, how many visits can they expect to have in the course of their treatment?
Well, Robert, that can really vary depending on how sudden onset the problem was or how acute. I say if this problem happened yesterday and you're 20, we can probably take care of it in one visit. Same kind of thing and generally with that whole body strain type of issue. If it's pretty sudden onset and you're pretty healthy in your day to day, we should be able to take care of 1 or 2 visits. If this is an issue that's been going on maybe half your life or even the past 20 years, it's going to take a few more visits than that because of the body's ability to kind of build up all these different restrictions and areas of compensation. That may take, I would say, an average of 4 to 6 visits to really get all of those layers removed and start getting down to what the original issue was.
So you treat all ages. What do you most commonly see in terms of age?
So I definitely treat all ages, and it really depends on the season. Depending right now, currently we're getting some shoveling-related injuries. But, I mean, my typical day, I can see, a 12-year-old, a 2-year-old, and then a 64-year-old all in the same half day. So really quite a bit of variety.
Well, we've been speaking today with Dr. Corey Beverly Waters, a neuromuscular skeletal medicine and osteopathic manipulative medicine, otherwise known as OMM specialist at Southern Maine Healthcare. Her office is at 655 Main Street in Saco. The hours are Monday through Friday, 8 to 5, and you can reach them at 207-602-3548. Dr. Waters, thanks for coming down to the show. It was great talking with you.
Thank you for having me, Robert.
Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities. Brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.